to our colleagues, to Neil of the Rhode Island Foundation and Courtney of United Way. Your leadership and your support are tremendously important right now as we work through this together as a state. And we know that this is something that you do regardless, so we appreciate you. And we want to give a huge kudos to Microsoft as well for stepping up, and we hope that other entities will follow. I want to give a special thank you as well to our healthcare provider community. These are our folks who are on the front lines out there now, that we're working extremely hard to get them personal protective equipment, to get them support in caring for patients. That is the community that we are all doing the steps that we're requiring you to do to be able to help that community who's out there. So a huge thank you to our healthcare providers. So a quick data update. Since we last spoke, as mentioned, Rhode Island has 2 new cases. One is a man in his 50s. He has a recent travel history to many different locations, including Germany and the United Kingdom. The second case is a woman in her 40s. We're working to determine the origin of her illness. These individuals are both at home and they're both recovering. That brings our total number of positives to 23. We have had 403 negative tests, and close to 3,000 people are now self-quarantining. Those are our unsung heroes who are doing their part to help make sure the remaining population in Rhode Island is protected. So let's make sure to appreciate them as well. As always, we will continue to include these updated numbers in our press release today, and we'll post them online. So I want to start with our Rhode Island Department of Health State Health Laboratories. They are doing phenomenal work. We have the supplies, and with their work, we have the expanded human capacity at the Rhode State Health Laboratories to do the expedited testing that I spoke about yesterday. So this expedited testing is for patients who are hospitalized, patients who are living in nursing homes or other congregate settings, and for healthcare workers, including MS. We're continuing to work with our congressional delegation and with the governor, are really calling out to our federal government to get the swabbing kits that are needed to fully support the testing for additional populations at other laboratories. As I said yesterday, testing is helpful for us overall as a state to understand the scope of the situation here. It's also helpful to know that at the individual level, particularly for those that have the mild to moderate illness who can recover at home, it's not going to impact the treatment recommendations that you receive to get testing. I want to make sure that everyone understands what the key is with this virus. The virus spreads illness from person to person in crowds and in those situations. So when someone is ill, whether it's COVID-19 or the flu or another viral infection, being able to stay home and recover safely there is critical to help minimize spread of this illness. To share a few additional brief updates, we're sending guidance today to oral health professionals. Our instruction is that dental offices should suspend non-essential, non-urgent dental care for the next 21 days, which is in line with the guidance from the American Dental Association that has been shared. We will continue to be engaged with our dentists and revisit this with them and other oral health professionals in the coming weeks. We've also received a lot of questions about funerals and wakes. So we want to offer some clarification here that stays in line with what the governor has been asking. Our guidance remains to avoid large events and crowds. That single families need. This is a hard message to deliver. We are very aware of how important it is to gather with family and friends to grieve the loss of a loved one. But this guidance is about keeping the other people in your life, those other loved ones in your life, healthy and safe. When in doubt, just stay home and continue to use the remote services, telephone, video conferencing, and other ways that you can to support each other. Another update is about calling 911. We want to make this clear. If someone is experiencing a genuine medical emergency, a heart attack, someone collapses, absolutely call 911. However, if someone is not experiencing a genuine medical emergency, please do not call 911. We want to refrain from straining our healthcare system, which would mean that emergency medical services, EMS, that would respond would have to use a set of personal protective equipment such as respirators or masks when they are not necessary if they are called for situations that do not require a genuine medical emergency. We have the supply of personal protective equipment that we need for our healthcare workers right now, but we need to be thoughtful and need to be judicious about how we are going forward. Finally, I want to bring up the 2020 census. You've heard us talk about the census in the past, and it's here. I'm particularly mentioning it because our Rhode Island Foundation and United Way colleagues have been right here with us in helping to make sure that Rhode Island positions ourselves best regarding the census. People are starting to get their notices in the mail to go online and fill out the census. It only takes about 5 minutes to do so. Myself, the governor, Neil, Courtney, and others have been talking about the importance of the census for quite some time.